So Mary is currently the Vice President of Programs for the YWCA of Niagara Frontier. She's had a lifelong commitment to serving the most vulnerable populations. Her advocacy is rooted in a deep experience, and she really had a heartbreaking loss of her mother due to preventable medical errors. So we share that same story, and I'm so sorry for your loss. So her passion is likewise with the rest of us, fueled by her experience, her ability to tell stories, connect health policy makers, connect providers, public health officials, and her story is really a compelling call to action. So,
Are
you turned on?
I think so. Can you hear me? Is this good? Okay, well, thank you, Dr. Brashear, and a very special thank you to Dr. Jill Cizak for the kind invitation to participate in this symposium. It's an honor to be with you this morning to explore the concept of the sandwich generation. Wow, what a descriptive moniker for a demographic coined by social worker Dorothy Miller way back in 1981. The term reminds me, frankly, of former First Lady Rosalind Carter's comment that there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. Throughout my life, I have embraced many titles: mom, daughter, wife, manager, friend, community activist, even baby boomer. But frankly, until I received the call from Dr. Cizak asking me to share with you my personal journey, I never really once thought of myself in terms of being a member of the sandwich generation. So I did a little bit of research on my own, and I went so far as to survey friends and coworkers and family members to see what, if anything, they knew about the concept of the sandwich generation. And surprisingly, not one person could identify the key definitions or even the characteristics of the sandwich generation, which would include, of course, dual caregiving for children under 18 while also caring for aging parents, the potential to experience financial strain while caring for both children and parents, caregiver role overload, and the risk of significant physical exhaustion, emotional stress, and depression from the dual caregiving responsibilities. By definition, I was a part of the 54% of Americans in their 40s at the time, employed full-time, who had an aging parent and children under the age of 18. We had a son in his first year of college, a daughter in high school, a son in middle school, and an 88-year-old mother. I was then and continue to be the Vice President of Programs for the YWCA of the Niagara Frontier. But when I did a bit more of a deep dive into the peer-reviewed literature, which included information from IHI, the Pew Research Foundation, and the clinical gerontologist, I had a difficult time, frankly, identifying myself with the characteristics that seemed to focus really primarily on negative experiences. And I shared this with Dr. Cizak when we had our first conversation. And quite honestly, I thought that a lot of those, the way it was being presented, smacked a bit of ageism. Researcher Toby Abramson actually referred to adults hard-pressed to care for aging parents, young children, or disabled children as the panini sandwich generation. And if we're going to frame working adults caring for parents and children in culinary terms, just having come back from Maine, I think of myself more as a rich, comforting lobster roll filled to the brim with generations and complementing and nourishing each other. You see, I was not raised by in a post-World War II nuclear family. That was not my life experience with 2 or 3 children. I was raised by a single mother. There they are. My mother, myself as an infant, my grandparents, and a cousin. I was raised by mom, and we lived with my grandmother and my aunt and my grandfather. And we, all five of us, lived in a small 3-bedroom, 1-bathroom house. While my mother went to work, my grandparents and my godmother took care of me. And, it was truly an intergenerational experience, as you can imagine. Money was tight, but boy, I'll tell you, love was abundant. And my mom, here I am with Gramps. There's my mom, 1921, with her grandmother, was raised in a similar family dynamic in the 1920s and 30s, in the midst of the Great Depression, with her mother, her brother, and her maternal grandparents. In a sense, without knowing it, our family had developed a well-honed caregiving systems theory. When children needed family support, parents provided the safety net. And when parents aged, the children cared for them at home. It was an organic system of reciprocal caregiving, really seemingly as old as time itself. It was not obligatory. It was not a burden. It was natural, just what you did for people who were there when you needed them. And there I am at about 4, my mother at about 10, at the same home, about 3 decades apart. So I was raised actually in the same home my mother had been raised in. So there we are. So anyway, it was, being a dual caregiver presents unique challenges, as Dr. Brashear mentioned. To be sure, there is no manual for how to successfully navigate all of the unforeseen sandwich generation dynamics. And I think, applause to Dr. Cizak and Dr. Brashear for wanting to really provide that kind of help. However, from my lived experience, I would like to offer a bit of an alternative view of the sandwich generation experience, one that shines a light not on the burdens, but on the blessings of having the opportunities to strengthen family bonds, not on the potential strain on physical and mental health, but on the opportunity for my children to honor the wisdom offered by their older family members, to value the grandparents' cherished place in our family, and show their love and respect for caring for other and older family members of our family. In short, to choose an attitude focused on the many positive aspects that being in the middle of and caring for 2 generations offers. And if that's not enough of a reason to see the positive aspects, there are actually numerous studies that point to the role of multi-generational living having a positive and measurable role in enhancing longevity. When my husband John and I had our children, it was my mom who cared for them, much as the generations of grandparents in her family had done before her. It was sort of like what was old is new again. She ate dinner with us most evenings. She was our children's biggest cheerleader. She went to their sporting events, to their concerts and plays, had them to her house for overnights, and drove them everywhere they wanted to go. She went on vacations with us, was there for every single holiday and milestone. In short, she really was a lifesaver for my husband John and me. We weren't a family of 5, we were a family of 6, and she had a place at our dining room table. So we couldn't have managed, honestly, and John is here, and I think he would attest to that. We could not have managed without her assistance. With 3 active kids and without her loving support. Mom was on a fixed income. Thank you. Mom was on a fixed income, and we helped her out financially, much as we help out our adult children as they were becoming established. Did we have our disagreements at that time? Absolutely. What mother and daughter don't have, minor squabbles or disagreements? And was there tension? Are you kidding me? With a house of 3 teenagers? Yeah, absolutely. But that was really, frankly, it was negligible at that time. Quite frankly, Mom was a delight. There she is. Mom was a delight. She was spontaneous, funny, and always on the move, quick with a joke and always in motion. She was remarkably healthy, despite having suffered a TIA, a few years earlier, could nail all of the 8 activities of daily living and was only on 3 medications while at home. That is, until she experienced, and there it is, the dreaded cascade chart that will chart from July 3rd, what I consider a sentinel event, to her passing on August 29th. So I won't go through every single slide and all of the ramifications there, or we would be here much of today. But that was, she was active and healthy until she experienced a cascade of shocking and preventable medical errors when hospitalized for a minor illness. And that included medication error, polypharmacy, and multiple hospital-acquired infections, including MRSA, C. difficile, UTI, and VRE, that took her from being an enthusiastic member of her 70th high school steering committee for their reunion, wanting to kick up her heels at that reunion, and within 6 weeks, dying from sepsis after her initial hospitalization for routine treatment of gout. My laser focus during those 6 weeks was on trying to keep her alive. Unfortunately, the cascade of medical errors proved to be too much for my once vital and intrepid mother to survive, and she perished 42 days after initial hospitalization. Just as there is not a tried and true manual for navigating the twists and turns experienced daily by the Sandwich Generation, there is no guidebook, I can tell you, to navigate the complex, confusing, often intimidating world of healthcare, especially when caring for a senior. Let me be perfectly clear. Ageism in all its forms is alive and well in society, but especially present and deadly in healthcare. There are so many things I wish I had known from the outset of Mom's deadly healthcare journey. And much as Dr. Brashear mentioned her own father's healthcare journey, it was a very similar, daily thought for me. What could I have done? I wish I had known. Among the most crucial is how important it would have been if I had checked her medication list when she was admitted to the hospital and then rehab facility. I had no earthly idea that the anticholinergic medication Flexeril, improperly prescribed in the emergency department of the hospital for pain in her neck when she drove herself to the hospital, and be careful what you ask for, said, please give me something, and Flexeril was prescribed. I had no idea, again, that would be, that would follow her into the hospital when she was a little white cup on the bedside table when she was hospitalized. It was not a medication she was taking on a regular basis while at home. This medication is listed on the Beers criteria for potentially dangerous medication for seniors, and was given to Mom 3 times a day while in the hospital, and then when she was transferred to a rehab facility for physical therapy, because of faulty medication reconciliation. And at that time, I had no idea what faulty medication reconciliation was. And in my opinion, that was the sentinel event that became this train wreck of a healthcare journey. We had been alerted to the danger of the medication by her neurologist, who had been treating her. She was on at home, which included lisinopril, warfarin, and an eye drop for like a pre-glaucoma eye condition. And then when the physician, the neurologist, looked at the list, he saw, Flexeril on that list. And he looked at Mom, and he looked at me, and he said, who would prescribe Flexeril for an 88-year-old woman? He proceeded to give us a crash course on the Beers criteria, which I had never heard of, and warned her never to take the medication. Don't get it refilled, just dispose of it properly, and just please don't ever take it again. We thought that was all there was to it. Until, until she was hospitalized, never dreaming, frankly, never dreaming that it would be included on the list of medications prescribed woulda, coulda, shoulda moments of my life, or the rehab facility, nor has she been told by the nurses giving her the daily meds what was in that little white cup. Here, Mrs. Brennan, here's your lisinopril, here's your warfarin, oh, and here's your Flexeril. That conversation never happened in any of the time she was in the hospital or in the rehab facility. We were blindly trusting. And as I think the majority of families are, frankly. We were blindly trusting that what she was being given was appropriate. Why would we have thought otherwise, I guess, in my mind at that time? And how wrong we were. After unwittingly taking the medication for 16 days, 3 times a day at the hospital and the rehab facility, Mom experienced every single one of the serious side effects, including, but not limited to, a depressed appetite, urinary retention, nausea, unsteady gait, lethargy, and most horrifying of all, uncontrollable, violent hallucinations. It was not until she began showing symptoms of an adverse reaction to the drug that I asked to see her medication list, and this is when she was at the rehab facility. And there it was, in black and white, Flexeril was on the list. And all I could hear at that time, standing out, I can still see it, standing out at that nurse's station with my mother in a wheelchair, hunched over, having violent hallucinations, all I could hear in my head was that neurologist saying, "Don't take it, Mrs. Brennan, don't take it. This is a very dangerous drug for you." I told the charge nurse what the neurologist had said and asked to have her removed from it immediately. And my request was granted, but the die was already cast by that point. I requested a special consult from UB's chief of geriatrics, and upon examining Mom and reviewing her chart, he informed me that Mom was suffering from about the worst case of polypharmacy he thought he had ever seen in his career. By time of his examination, she was on, wait for it, 26 medications were on her chart, 26 medications, including, of all things, Haldol, and multiple other antipsychotics to combat the effects of the hallucinations. She would be given one drug, have a reaction. She'd be given another drug to take care of the reaction. It was endless. She never recovered from the side effects of the Flexeril and polypharmacy. In fact, she grew increasingly weaker, sicker, and was transferred to the hospital several times from the rehab facility. By the 5th week of this cascade of medical errors, our only option left was admission to hospice house. And she lasted 1 week there. And that is a photo of Mom upon admission to hospice house. That was, the first day she was admitted. And it is the face, I could be here with you all day long, but that's the face of medical error. That's the face of really not understanding what medications are harmful to seniors. That's the face of a lack of communication. I could go on and on. It was the incredible closeness of having shared the ups and downs of daily life together that helped my husband, who is here today, John, our children, my mother, and me to navigate those terrifying, uncharted waters. We didn't hide from our children what was transpiring with their grandmother. We had always been very open, and she was as important in our family as to my kids as my husband and I were to them. She was very much an important part of their lives. And during this time, our kids cut their teeth on learning how to be my mother's advocate. And in turn, they learned how to be their own advocates and, and for their own families today. It goes kind of harkens back to that time. They visited the hospital regularly, took her for walks in her wheelchair, sat with her, held her hand, and shared stories of what they did each day. While I grew increasingly concerned about them, while working full-time, while trying to keep my mother alive, I just wanted to make sure there was some sense of normalcy for them in their lives, because again, they were teenagers, between 13 and 18 at that time. And that's when my village at the time, my friends, stepped it up and became for them what my mother had been, driving them to sports practices, taking them to favorite drive-ins as a treat, teaching one of them to drive, and most importantly, loving them unconditionally. Mom perished after, as I mentioned, after a week in hospice house. And it was during that week that my kids had some of their most poignant times with my mother. The love they shared remained strong even as she was dying. And during one conversation with our oldest son, 18 at the time, she told him that she would find ways to send him messages from heaven. And as sick as she was, she retained her crazy sense of humor. So after that slide that I just showed you, that awful slide, when she was removed from all of those medications, I don't know if it was the environment at hospice house, I'm not sure what it was, but most probably the removal of all of the medication, we started to see who she was, who she had been, starting to come back a bit. And even in those last days, she had that crazy sense of humor back. And we had one day, like next to her final day, where we had this sort of high English tea, because she was all about, she was an Anglophile through and through. And she sat with a tea cozy on her head, singing Tea for Two, and just crazy stuff. Those are memories that my kids still cherish. Prior to doing my own research on the topic of the Sandwich Generation experiences, I was blissfully ignorant of how perilous the journey is for others. So I don't mean to make light of that by any stretch. I'm just giving you my personal experience from a multi-generational family. The journey that people have had that, didn't have the good fortune that I had had in my early intergenerational life experience, even in the midst of navigating the ups and downs of that awful healthcare experience, while also caring for my 3 kids, I really didn't, honestly, truthfully, I did not encounter the caregiver role overload that I read about, the anxiety or emotional distress or depression that is described in just about every piece of literature that I read about the sandwich generation. Having been raised in a similar dynamic with even fewer resources, I understand that not all members of the sandwich generation have had the benefits of having the kind of really robust and wonderful relationship that I had with my mother. And just to illustrate that, she was my maid of honor in my wedding, and I was in my daughter's wedding. I didn't experience the deep resentment that some people, I think, unfortunately have, or deep-seated anger over parental past hurts. Not all people caring for parents and young children were as fortunate, and I understand that, as I was, to have the behaviors of patience and empathy and respect modeled for them, as I did in my early childhood. And so it made caring for both young and old simultaneously, for me, it was kind of natural. It was just a natural part of family life. And not everyone facing the challenges of caring for parents and children have as supportive a spouse as I had at that time. So thank you, John, for that time. I suppose, upon reflecting on this, and it gave me really a lot of things to think about after getting that call from Dr. Cizak. And I thought about what did that role in the sandwich generation, what did that teach me? And I suppose that upon reflection, Team Alice, the interdisciplinary UB research team, named after my mother, Alice Brennan, that is focused on protecting older adults from medication-related harm across the continuum of care, using a three-pronged approach that incorporates interdisciplinary research, interprofessional education, and advocacy for national level policy change, was really born out of that sandwich generation experience. I didn't experience the negative physical and emotional strain of being a member of the sandwich generation, but I did experience, there was no doubt about it. I did experience anger at what had happened to my mother in healthcare systems we thought we could trust. The lack of infection control, lack of understanding of what medication is harmful to seniors, lack of communication between healthcare providers and patient and family caregivers, and a lack of transparency led to my reaching out to UB's Dr. Ranjit Singh and Dr. Sharon Huner from the School of Nursing to develop a patient safety curriculum for nurses and third-year medical students so that the Alice story was born. And it ultimately developed with Dr. Singh and Dr. Robert Waller into what we now know as Team Alice. My deep and abiding love for seniors was experienced first as a child, cared for by my mother and grandparents. I was privileged to care for my mother as she aged, while also caring for our three young children and fostering a strong bond between my mom and my kids. And again, reflecting on Rosalind Carter's profound philosophy on caregiving, I see my life coming full circle. I'm now the matriarch of our family, and how did that happen? Oh my. I still work full time and remain active with Team Alice. And my husband and I now have 5 grandchildren under the age of 3, between 8 months and 3 years old. And 3 of our kids want their children to have as strong a bond with us as they had with their grandmother. So much so that when the house next to ours was up for sale, our daughter and her husband and 1 child bought that house right next to us. Our 3rd son lives, oh my goodness, 15 miles away. So we have an active role with them. We see them sometimes daily. We continue to provide, if they need financial assistance, with, with a house repair or this or that, and provide them with childcare. It has really continued sort of that family tradition of intergenerational living. And my kids are now, as you can imagine, 10 to 12 years from being sandwich generation parents or generation cohorts themselves. I hope they will embrace the get to, not I have to see endless opportunities to foster bonds that will last a lifetime rather than seeing just a heavy and stressful burden. I hope that for them. I hope that for us. The lyrics from one of my mother's, my daughter's, and my favorite musical, Fiddler on the Roof, comes to mind. Sunrise, sunset, swiftly fly the years, one season following another, laden with happiness and tears. What words of wisdom can I give them? How can I help ease their way? There she is. And for me, the wisdom that my grandmother so generously shared with my mother and my mother with me. Faith, when troubles emerge, focus on the beauty of what we have with one another, to cherish time spent and overlook the, boy, often messy and chaotic life moments. And as a nod to my humorous mother, find plenty of reasons to laugh. Thank you very much for having me.
Mary, if we have a question or two.
Oh, sure.
Are you willing to take? Do we have any questions for Mary? Not monitoring the chat online, but I just wanted to check the room really quick. Sorry, online people, next time. So thank you so much.
Thank you, Jill.
We appreciate you telling your story. I think one of the things that Mary said that resonated with me is that my life experiences are similar to hers, that blessed with growing up with grandparents, great grandparents, and that sort of thing. And I think what you shared with us today gives us a good example of the blessings that come with some of the things that everybody's taking on. What we do hope, though, today that you'll take from our next panelist and all of the remainder of the day are some tools and some skills and some resources that can actually help with the caregiving and make things easier for everybody.
Thank you.
So thank you so much.
Thank you.